Yes, I think, again, we're refining minimally invasive techniques for many of our surgeries, big operations, things that have in the past used to be done through big incisions, and we used to want these huge exposures. We're really refining those. And kidney cancer, for instance, we're getting away from these large incisions. Most of those operations are done minimally invasively now with robotic techniques that are really changed the field for us in the past 10 or 15 years. Even the more advanced tumors where we used to gain huge access through thoracoabdominal incisions and expose the chest and the abdomen. Again, we're making surgical refinements there to have much more limited incisions and faster recovery for those patients. In bladder cancer, smaller incisions, for the most part, we've reached a bit of a plateau in how we do the operations. Most of it is small incremental changes, again, with these enhanced recovery techniques, and part of it is intraoperative management. We have better tools, decreasing blood loss in surgery, decreased blood transfusions. So those are exciting. Better visualization is always good. We have better techniques. When I look at how I did the operation 15 years ago to how I'm doing it now, I think that those smaller refinements have really made a difference in how patients are managed. And in testicular cancer, and one of the exciting things that I'm very, very close and dear to my heart is the extraperitoneal technique of getting, again, we used to make these very large incisions to access the retroperitoneum where these tumors metastasize, and over the past 10 years I've refined this technique for a midline extraperitoneal technique where we keep the bowels inside the abdomen and go and behind and resect these tumors and the lymph nodes. That really leads to a much more expedited recovery for the patients, often going home the next day after these major operations. What used to be a 5 to 7 day hospital stay, we're seeing these patients go home the next day. So it's a huge stride there in advancement of their perioperative care. So I'm very excited about these new things, and we continue to make further refinements to make things better for patients.